of the bones in the spine slips forward relative to the one below it. The exact cause of the disease is unknown, but it can run in families. The most common source of regional pain is 10 possible causes of back pain, from the rarest to the most common. Stay until the end, you'll be surprised. 1.5 billion people worldwide live with chronic pain. If you enjoy my content, subscribe. It takes just 1 second. But most importantly, leave me a comment to let me know you've subscribed, and share this video on social media. You can even create short videos from it. Help spread the message to reach and support as many people as possible. Finally, every month I offer a free consultation to one person via video call or directly at my clinic. Let me help you better understand your neuromusculoskeletal pain and provide you with personalized tools to manage it at home. To participate, subscribe to my YouTube channel and leave a comment under the video mentioning that you subscribed and describing the issue you'd like to discuss. Finally, to double your chances, visit www.cliniquepsb.com, go to the health articles section, sign up for my clinic's health newsletter, and choose an article to leave a comment with your YouTube username. Good luck to all! Before discussing rare conditions, it's important to note that back pain alone isn't a reliable indicator of severity. Contextual factors and warning signs like intense headaches, nausea, dizziness, incontinence, night pain, loss of muscle strength, sensation, or overall weight within a 6-month period are far more significant than the pain's intensity. A 10 out of 10 pain could be less serious than a 7 out of 10 on the pain scale. In general, neuromusculoskeletal pain is influenced by your movements and posture. However, more serious pain, often due to internal issues, isn't affected by your actions and tends to worsen over time. For rare conditions, pain alone isn't enough for a diagnosis. In medicine, it's crucial to remember this principle. If it looks like a horse, runs like a horse, and has 4 legs, it's not a zebra. This underscores the importance of considering the most common causes first. Spinal tumors are rare, and most are benign, meaning non-cancerous and typically don't cause serious health problems. Among the most common benign spinal tumors are meningiomas, tumors that form in the membranes surrounding the brain and spinal cord; schwannomas, tumors that develop from Schwann cells which cover nerves, but also myxopapillary ependymomas, which are tumors that arise from cells lining the spinal cord's channels. The most frequent spinal tumor is likely the hemangioma, a benign growth of blood vessels. Hemangiomas are often found incidentally during routine X-rays or screenings and generally don't cause significant symptoms. Abdominal aortic aneurysms are abnormal bulges in the wall of the aorta, the body's largest artery, which runs through the abdomen. The aorta carries oxygen-rich blood from the heart to the rest of the body. These aneurysms are most common in men aged 50 to 80 and can be hereditary. They also occur more frequently in people with high blood pressure, especially smokers. This condition can sometimes be discovered by chance during imaging tests, often due to atherosclerosis, a buildup of fats in the arteries. However, it's important not to panic. Surgery is only necessary if the aneurysm grows to a dangerous size. If detected early, close monitoring is essential, as surgery too soon could pose more risks than benefits. Some urinary tract conditions, such as kidney infections, infections of the kidneys, the organs that filter waste from the blood, kidney stones, small stones formed in the kidneys, or prostate infections, a gland located below the bladder in men, as well as certain pelvic conditions, problems related to the organs in the lower abdomen, such as ectopic pregnancy, when the embryo develops outside the uterus, or pelvic inflammatory diseases, infections of the female reproductive organs. As a result, these pains may sometimes be felt in the lower back, as the body can refer the pain to this area. Paget's disease of bone is a chronic condition that affects the bones, causing abnormal bone remodeling. This leads to thickening and weakening of the bones in certain areas, making them more fragile. While the disease can affect any bone, it primarily impacts the pelvis, femur, referred to as the thigh bone, and skull. The bones in the legs, spine, collarbones, and arms are less frequently affected. It affects about 2 to 3% of people over 55 years old, with the frequency increasing with age. The exact cause of the disease is unknown, but it can run in families. About 10% of cases are linked to specific genetic abnormalities, and viruses may also play a role, though there is no evidence to suggest the disease is contagious. Reactive arthritis, often triggered by a sexually transmitted infection. The term reactive in reactive arthritis means that the arthritis is triggered by an infection, often bacterial, in another part of the body, such as a sexually transmitted infection or an intestinal infection. The immune system, in reacting to the infection, mistakenly attacks the joints, causing pain and inflammation. Ankylosing spondylitis is a chronic inflammatory disease that primarily affects the spine. It progressively causes the ligaments to turn into bone, permanently altering the spine's curves and limiting movement. In severe cases, those affected often have difficulty sleeping on their back or stomach. Spondylolisthesis is a condition where a vertebra, one of the bones in the spine, slips forward relative to the one below it. This slippage often occurs in the lower back, referred to as the lumbar region, and is more common in teenagers and young adults, especially athletes or older adults. In younger individuals, it is typically caused by a congenital defect present from birth or repetitive injuries that weaken the vertebra. In older adults, it is primarily related to wear and tear of the discs, the cushioning pads between the vertebrae, or osteoarthritis, referred to as joint degeneration. Please keep in mind that the term osteoarthritis is not entirely accurate in this context. The proper term would be osteoarthrosis, as, unlike an inflammatory condition such as arthritis, the degeneration of the body's joints does not involve an inflammatory process. A vertebral compression fracture often occurs when bones become brittle due to osteoporosis, a condition that reduces bone density with age. The vertebrae, bones of the spine, are particularly vulnerable to this loss of density. In a compression fracture, the vertebra collapses, sometimes compressing nearby nerves. These fractures most commonly occur in the upper or middle back, causing pain in those areas. However, intense trauma, such as a high fall onto the heels, can also cause this type of fracture. Many patients are diagnosed with degenerative processes in various parts of the body, often without any associated symptoms. In the spine, this may include conditions such as osteoarthritis, herniated discs, or even early signs of stenosis, narrowing of the spinal canal, but without any real functional impact. This also applies to the joints in the shoulders, hips, knees, and others. Degenerative processes are mainly considered risk factors that can increase the likelihood of experiencing sensitivity in the affected area, but they do not necessarily cause symptoms. Furthermore, even if you have them and pain, we should not assume that one is causing the other. Therefore, receiving such a diagnosis should not lead to a pessimistic view of your health. A gradual return to movement and strengthening exercises can, over time, help improve your condition and quality of life. This diagnosis is common, largely due to overdiagnosis. Fibromyalgia is sometimes seen as a catch-all, a diagnostic dumping ground. For example, if someone experiences diffuse pain in the back, knees, neck, shoulders, but all tests, blood work, x-rays, MRIs show no evidence of an inflammatory or chronic disease, a fibromyalgia diagnosis might be made by default. However, it is entirely possible to suffer from chronic pain without it being fibromyalgia, which remains a diagnosis of exclusion. To diagnose fibromyalgia, only a rheumatologist can evaluate this condition using a very specific set of criteria. Furthermore, this condition is complex and is often diagnosed after the age of 30, which can make it difficult to distinguish between chronic pain and a decrease in muscle and joint tolerance due to inactivity. Generally, this type of injury results from excessive stretching or lifting heavy loads quickly, causing pain. However, it is important to distinguish these intense movements from more common wrong moves, which can also cause significant pain without tissue damage. Therefore, the most common source is people who haven't yet taken the time to subscribe and click on the little bell to be notified of all my future videos. The most common source of regional pain is non-specific pain. In addition to awkward movements or having a bad night's sleep, it often occurs without any specific incident. It can limit movements such as bending, turning the head, or lifting the arm, and is not caused by displacement, inflammation, or tissue damage. This temporary sensitivity is actually a protective reaction from the body, triggering pain and muscle tension to encourage you to avoid repetitive actions that could, in the long run, lead to injury. If this topic interests you, the link should appear right here. In the meantime, feel free to share your story, comments, suggestions, or simply ask if you have any more questions. Because with knowledge, you build your autonomy, navigating your health with more certainty.